Today was the biggest opioid takedown of medical professionals in U.S. history. Many of them right here in Tennessee, accused of illegally prescribing opioids. News Channel 5's Matthew Torres was in court for some of their hearings.
Rory, of the 32 medical professionals charged in the state, 9 of them were right here from Middle Tennessee. One case is Dr. Daryl Reinhardt, formerly of Columbia, accused of overprescribing, with 4 of his frequent patients eventually dying.
We're stopping corrupt medical professionals in their tracks.
Federal officials touted a big takedown in the fight against the opioid crisis. Today, they announced the largest prescription law enforcement operation in U.S. history, with more than 60 arrests of medical professionals across 6 states, including the volunteer state.
These cases involve approximately 350,000 opioid prescriptions and more than 32 million pills.
Through a newly formed opioid strike force with an office in Nashville, more than half of the arrests were in Tennessee. 9 of the cases were in the mid-state. They're accused of illegally prescribing opioids and other strong drugs and healthcare fraud schemes.
To be clear, this effort is not targeting the individuals who are caught in the cycle of addiction.
News Channel 5 was in federal court as 5 of the 9 defendants pled not guilty, including Dr. Lawrence Valdez of Hendersonville, accused of overprescribing for a year. In 2017, the TBI also said he was prescribing in exchange for money and sexual acts. Dr. Timothy Abbott of Nashville and Dr. Boydoin Smith of Carthage also faced charges for prescribing outside the usual course of professional practice and without legitimate medical purpose.
It illustrates the lure of greed and making a profit at the expense of those that need treatment.
And then there are charges against Daniel Seeley, Brian Ritchie, and Jonathan White for an alleged healthcare fraud. Court documents say all 3 were employed by Med Management in Franklin and provided services which were neither medically needed or anatomically impossible, and submitting $3.5 million in claims.
To identify and prosecute those who have abused and misused their medical licenses and are simply white-coated drug dealers.
And today we have learned that those defendants either aren't allowed to prescribe or their medical capabilities have been strictly limited. Patients affected by this could call the statewide crisis line at the number on your screen.